Good morning, Rusinga School. I hope you're all doing very well. Welcome to our Health and Safety Assembly. This is our Health and Safety Week. God has been gracious to us and kept us all safe. I also hope that we have been careful to wash our hands, to sanitize, and keep social distance. To usher us into this week, I welcome our school nurses, Ms. Regina and Ms. Phyllis, together with a special guest, Mr. Kakaire, who is also a parent in our school. Thank you.
Hello Rusinga family, we are here, the nurses are here. We are super excited to be here with you. Today we are going to be having a conversation with one of our parents, and the conversation is around the COVID season. I know these are difficult times for everyone, and I'm sure through God everything is possible. There are so many anxieties, but remember there is support. We all have support. We can be able to reach out to people who are able to help us. We need to exercise, take care of ourselves, and remember social distancing, hygiene, and taking care of ourselves so that we can improve our immunity. Today we're having a conversation about our roles. That is the teachers, the parents, and the students. We all have a role to play during the COVID season to make it easier for us and to be able to cope. With us is our parent. His name is Mr. Schultz Kakaire. He works with UNICEF, but the most important thing, he's one of us. He's a parent, and please welcome him and let's learn from him.
So, Mr. Schultz Kakaire, it's really good to have you at Rusinga School to do our collaboration. We understand that our kids are really going through a lot, our parents and teachers as well. So today we'd like you to share with us what is the role of the child during this COVID season, what is the role of the parent, and what is the role of the teacher.
Thank you very much, Regina, and again thank you to you and the school for inviting me to be part of this conversation. It's very interesting for me because I do this from the perspective of a parent. I've got two young men in this school and another one at home. So this conversation really fits into, how they are dealing with the situation, but also how I am dealing with the situation. Regina, I think before we even go into any detail, I just really want to reiterate what your what your cabinet secretary for health has said before, that COVID is different. And he has specifically said that if we treat this disease normally, it's going to treat us abnormally. So I think that for me is the background for this conversation. Also, it's interesting to note and very important to note that nobody has experience in this. So, from the perspective of the child, from the perspective of the parents, from the perspective of the teachers, nobody has experience. So we're all learning along the way. We're all experiencing things the same way, although the consequences might be different. So I don't know if you want us to talk about the roles, of each of these different groups together, or you want us to focus on one group at a time?
We can focus on one group at a time. We can start with the role of the child.
Thank you again for that guidance. In terms of the role of the child, really, I would categorize that role into three. One is, as a child, you really need to be able to practice the recommended behavior. We know the key actions that we've been advised to take in order to ensure that we protect both ourselves as well as those who are around us. It could be our parents, it could be the friends, or it could be somebody who lives within the neighborhood. These key actions really are clear, but just for purposes of repeating these, the basic really is wash your hands with soap and running water. In the absence of that, use an alcohol-based sanitizer. This is really one of the key actions that we need to ensure that we prevent this. The other is really practicing, cough etiquettes. We've been told that one of the best ways to prevent this is, if you must cough or sneeze, please don't do it in your hands, do it in a flexed elbow, because by doing that, then you prevent the, the spread of droplets. We really know that COVID spreads through droplets. So when you cough or when you sneeze, and the droplets really get exposed, and that is what poses the danger to the spread of the disease. We also have been told to keep social distance, really keeping away from the other person. Initially, it really used to be keeping away from the person who has flu-like symptoms. But with time, and again, Regina, remember, this is new. Nobody has experience in this. We have learned recently that a lot of people of cases of COVID do not even show symptoms, which is why it's very important that we keep we continue keeping that social distance as it's been, because by doing that, you prevent yourself, and the other person from getting into contact with the droplets. We've been told that when you sneeze or when you cough, the droplets don't go beyond, a meter or so. So it's important to keep that distance. The other key action really that you need to take is when you feel unwell. First of all, don't keep quiet about it. Say it. Stay home, but also most importantly, notify your parents if you develop a cough, if you're sneezing, or if you feel a bit of fever. Please do let your parents know so that they are able to know what action to take in terms of preventing. If you're going out, we know that this is one of the regulations that the government has put in place. You really need to put on a mask, and by putting on a mask, you prevent the spread of the droplets. That really is the mechanism that COVID is transmitted. The other really is, so it's wash your hands, it's practice cough etiquette, it's stay at home, if you feel if you feel a fever or any of the symptoms, wear a mask every time you stay out, and seek medical care if you're feeling unwell. And I mean, again, Regina, this is not unique to COVID. It's really typically what anybody needs to do to prevent themselves from getting the diseases. The other key emphasis that I would really want to bring up, especially for the students or for the children, is you talk to your parents. We know that COVID has affected us, but most especially the children, in different ways. You're not able to interact with your friends. You're not able to go out and pick your ice cream. You're not able to talk to your teacher, to even see them. Talk to your parent, and raise all those issues that you want them to be able to address. And if it's challenges that you're facing, talk to them and see how they can help you deal with it. So it's sort of two-way. Talk to them, raise those issues, but also most importantly, listen to them. The parents are going through the same challenges as you are as a child. So you need to be able to also consider that, listen to them. Your parents are going through challenges of raising school fees to pay to ensure that you're back to school. They are worrying about whether they will have a job after this, or whether there's going to be a reduction in their pay. They are worrying about the rent that they have to pay and so many other things. So it's important that you listen to them, because they have as many worries as you do. It's important that you raise the issues that you want them to listen to, and most importantly, practice the recommended actions for you to be able to keep yourself safe, as well as those within your nearest environment.
Thank you, Mr. Schultz, for that input. And kids, you've had it. Wash your hands, social distance, practice good hygiene. So now we'll talk about the role of the parent. We know our kids really are going through a lot. Parents are also going through a lot at home. It's difficult for the parent to cope with the child at home. Some of the kids would relate better with the teachers in school in terms of sharing the weak areas in school. So what is the role of the parent at this particular point?
Thanks, Regina, for that question. And again, I mean, this question is closely linked to the first one around the role of parents, and I mean rather the role of students. And again, as I mentioned at the start, these thoughts that I'm sharing with you are my thoughts as a parent, as somebody who has children, two. Again, I mentioned two in this school, two at home, and they are boys. That brings in another aspect to it, because it's a busy house. So the role of the parent really, again, linked to what I said before, for the students. I think for the parents, it's also three ways that I see this. One of them is is helping the children to ensure that they are practicing the recommended actions. It's very easy for the children to forget, these key actions that they need to undertake. So your role number one is to ensure and remind them, to ensure that they are keeping they are keeping up with the key actions that they need to take to protect themselves. The other really is acting as a role model. Children tend to look up to us in terms of behavior. So if these are the key behaviors that you're telling them to practice, it's important that you're also practicing them, because most times the children will even just be able to mimic what you're doing. So if they see you washing your hands all the time, if they see the way you practice cough etiquette, if all the other aspects of prevention that you need to undertake, be the role model that behavior that you want them to undertake as part of prevention. That's point number one. Point number two, really, and again, it ties into what I said for the students, is that you need to constantly talk to these children. Talk to them, listen to them, understand what their concerns are. Because over the last few weeks when I've been home, I have realized that one of the most important things that needs to happen is to keep probing. It's a way of doing a survey. It's a mini survey that you're doing to find out, to get feedback from these children in terms of what are the issues that concern them. I have realized, again, from my personal perspective recently, that the concerns, for my children at the moment are around the fact that they've been home too long and they are not able to see their friends. That is bothering them. Regina, I did tell you that I'm from Uganda, and we have this, we go home quite often, and the children have been accustomed to that. They've not been able to do that in a while, since December. They had tuned their minds into going home, immediately at the start of the school holiday. That didn't happen. So it's bothering them that they haven't been able to go home, that they are not able to see their friends. And most importantly, again, as I did mention to you, they have this worry about, death. They are saying, I worry about dying and not being able to see my friends again, and not being able to see my mother. It's interesting because the fathers are not even part of this conversation. Their really concern is around being able to catch up with their friends and seeing their mother. So you need to be able to listen to that and address those key issues as they are. There's a tendency for this conversation to even veer off COVID and become something else. This is something that we're doing in my workspace, because I work in this field. And one of the things that we're doing with communities is seeking feedback from them. What are the key issues that are concerning them that really we need to be handling? A lot of them are veering more away from COVID and more around survival. It's about lockdowns. It's about being able to survive the next day. It's about being able to raise, the resources that they need to keep a family. So the point number two really for parents is continuously seek feedback from these children to understand how they are coping, to understand the issues that are affecting them, and how you need to be able to move forward with this. And then lastly is, for parents, I think it's a learning. Again, Regina, I did mention this is a learning period. I think speaking as a parent, speaking as somebody who's working from home, honestly, I know this is happening to me, but it's happening to all the other parents. Everybody else who's working from home is working much more than they would during peacetime, as we call it. You're spending more time on calls, on Zoom calls. You're spending more time on the computer. You're learning to juggle between, home issues and work issues and children issues. And now there's even the new aspect of supporting the children to study. So you need to learn to adjust and adapt and deal with that situation. Listen to yourself. I think you need some personal time of reflection to say, what are the issues that are affecting and how do I need to be able to deal with this. So I think, again, like I mentioned for the students, I think in terms of the parents, those are the three key areas. Support the children to practice key behaviors, model the behaviors you want them to do, listen to them, seek their feedback about how this context is affecting them, and thirdly, listen to yourself and pick up things that you think are able to help you to adapt to this situation. Again, as I mentioned at the start, abnormal times call for abnormal ways of doing things.
So thank you so much, Mr. Schultz. We really appreciate what you shared with the Rusinga family. And I'm sure everyone is going through a tough time at this point. And we want to thank our teachers for what they are doing. They have gone an extra mile in the education sector. And we really want to thank them. They've really actually turned their homes into offices. So what advice would you tell the teachers?
Thank you, Regina, for that. I'm privileged to be a son of two teachers, retired teachers. Thank God they are still alive. One is 84 and the other is 78, so quite advanced. And I've always mentioned that I don't think teaching is a profession. I think teaching is a calling. So teachers, I have a soft spot for teachers. It's a shame that I didn't go that way, and none of my other 7 siblings went that way, because we saw the challenges that our parents went through while raising us and the work that they had to do. So to begin with, really, again, as you mentioned, is to thank the teachers for the effort, the extra effort that they are putting into this. It's new times. Nobody has done online teaching or online classes for 8 hours a day. If they've done it, they've probably done it before for 20 minutes, 30 minutes. It's very challenging. It's keeping your eyes on the computer all the time. It's actually the back end of it for me is what I give up for teachers about. How do you even ensure that the students are listening? Everybody else is in their own homes, they're in different, others are taking the calls from the bedroom, from the sitting room, from the kitchen, from the balcony. There's too much noise in the background. How do you ensure that discipline? I mean, the things that you do when you have the students in class. So I think, to begin with, is to thank the teachers for the effort that they are putting into this, and to really say that, as a parent, we are trying as much as we can to see that this goes well. Really, maybe 2 or 3 things that I would see as the role of what teachers need to do to this. One is to seek feedback, and again, Regina, for me, these roles are all linked. They sort of apply differently to the different groups of categories. For the teachers, I think really teachers, what I would ask of you is to help seek feedback from the students, because there's probably things that are happening that we don't know as parents, that you would be able to get from the students. So seek feedback from them, see how they are doing, what their perceptions are around the whole entire new experience of learning online, deal with some of those issues. I know for a fact that many times our children are more comfortable with their teachers. They confide in you in terms of so many things, and I know this for a fact because times when I have issues with the young men, and I come to school to talk to the teachers, I learn a lot of things, from that conversation. So continue to bridge that gap. I don't know how you do it from a distance, but I mean, this is your calling. So I don't even have any advice on that, but use your calling to determine how to do that. But don't forget that, because it's very important. So, Regina, I know you've concluded this conversation, but allow me bring in something that's maybe it's off topic, but for me, I think it ties into this conversation. To really appreciate the school the management and board of Rusinga for really being considerate and being adaptive to the current context. I'm talking about this in terms of the discounts. I know that they might not be enough. I know there's conversation still going on, but I really want to appreciate the school, the board, management, and the teachers for that consideration in terms of giving the discount to, to us, the parents, to ensure that we adjust to the times. I've been following the conversations which are going on in the papers about some schools, and I think it's really, as parents, we need to say thank you to this school. I read a newspaper, I think it was last weekend, which was talking about 2 schools. It was a whole, piece about, how international schools and, are dealing with this. And I don't remember what the headline was, but something very sarcastic about, the rich also cry, something like that. And they were talking about how international schools are exploiting parents, and asking for, for the regular school fees that they pay without being considerate of that. And in that newspaper, towards the end, they mentioned 2 schools which had already put all these things into consideration. They mentioned Rusinga and they mentioned Hillcrest. It's no wonder that they mentioned those 2 schools, because I think there's a background to those 2 schools that the others don't. So that's a piece that I really thought I need to bring into this conversation to thank the school. I know the conversations are still going on, but it's important to point that out.
I hope the conversation has been helpful. Our contacts are on the screen if you need to reach us. And remember, stay safe.